We begin tonight with a dramatic drop in drug overdose deaths nationwide, a 27% decrease. But we did some digging and found that is not the trend here in Nevada. Take a look at this map. The darker blue spots show the areas with the biggest decline. The lighter blue areas saw a moderate decrease, but Nevada and South Dakota were the only states that actually saw an increase. And thank you so much for joining us live at 5. I'm Trisha Keene.
And I'm Abel Garcia. Now, to understand what's being done to combat the problem right here in the Silver State, I introduce you to one local man who is turning pain into purpose.
I started using substances when I was 13 years old.
For Sean O'Donnell, he tells me his addiction started young.
The Narcan nasal spray that we
Years later, an overdose would rattle his family, but he says it wouldn't be the last.
The first time that I had overdosed, it sent a message to my family members, right? That this had gone too far. I lost my partner to a preventable overdose in 2017.
Sean says that loss changed everything. He refocused his life and became the executive director of the Foundation for Recovery to help other addicts.
After losing him, I knew that I couldn't be quiet any longer.
Nationally, the CDC reports overdose deaths dropped from 110,000 in 2023 to 80,000 in 2024. But Nevada went in the opposite direction with a 4.64% rise. Statewide overdose deaths in our state climbed to 1,465.
How does it make you feel that you live in a state where we're continuing to see this being a problem?
You know, I'm a little disheartened by it. It makes me feel for the other families who have lost loved ones to this.
In a report from November of 2024, the Clark County Opioid Task Force attributes Nevada's overdose crisis to a surge in fentanyl use and a lack of accessible treatment. According to their report, overdose rates are highest in areas facing housing instability, unemployment, and gaps in mental health care.
Something clearly isn't working here in our community, so we need to do better.
Sean says with the help of the Southern Nevada Health District, Foundation for Recovery is now leading the way on a new initiative, door-to-door outreach, launching in June.
Our goal is to knock 100,000 doors per year in Southern Nevada, talking to our residents, giving them resources, distributing Narcan, distributing fentanyl test strips so we can get the word out. Kind of like an allergy medication.
He says it's both a personal mission and a community call to action.
What would you personally like to see done here in Southern Nevada to try to reduce the number of people that we're losing to overdose?
Yeah, I mean, I think that we need to have a better outreach strategy. This is someone's son upstairs in their bedroom, right? This is someone's roommate. These are the people who are overdosing in our community.
A very sad truth. Now, I did reach out to the health district to see what else is being done to address this. That response reads in part, quote, the Southern Nevada Health District recognizes the critical importance of addressing substance use and overdose prevention as a public health priority. The health district has resources for overdose prevention, including a data dashboard, mail-based harm reduction resources, and overdose prevention trainings. And of course, I'll have those links to those resources with this story on our website's homepage.